The broadcast is now starting. All attendees are in listen-only mode.
Thank you everyone for joining us for another Learning Lunch hosted by Formed Approved and formedtraining.com. My name is Brian Johnson. I'm the Senior Director of Online Training and Education with Formed Training, and I'll be your moderator today. Today's Learning Lunch will cover how to share best practices regarding EHR with other medical providers. We are joined today by Dr. Helga Rippen of Health IT Exchange. Dr. Rippen has invaluable experience in EHR roadmap development and HIT adoption. In addition to her work as a CHIO and Vice President in the private sector, she has served as an advisor to HHS and was present at the birth of the ONC, metaphorically speaking. Among other positions, she currently serves as the chair of the Executive Council of Health IT Exchange, a nonprofit organization that we will learn more about today. Before we begin, some quick notes for our attendees. If you have questions during this session, please enter them into the chat area during the presentation. In the second half of our presentation, we will address as many questions as time allows. If we do run out of time, answers to all submitted questions will be posted to our website and sent via email link later in the week. Also, note that all registered attendees of today's session will receive an email with links to both the recorded and PDF versions of this event. All right, Dr. Rippen, let's begin. So why is the implementation and use of EHRs difficult?
Well, because you have a lot of different things coming together. The first, as we all know, an electronic health record is a very complex application. It actually has to support the clinical office in a very complex workflow. And also it has to support a lot of different types of users. So you add that to a complex computer system, it actually makes it pretty difficult to do right. So what am I really talking about? Well, usually patients come in, and so you usually have a practice management system. And what that requires is the ability to do scheduling, to actually be able to coordinate with the patient as it relates to times, but also insurance. It also has to be able to then serve at the back end to make sure that billing is carried out. And then what happens is then the patient is asked to add a lot of information about their family history, about any allergies, and other medical conditions. So even the beginning part is complicated. Then we have to move into actually being seen by, say, a nurse or even the physician themselves. And what happens? You have to get your vital signs taken. And again, remember that vital signs aren't just blood pressure. Sometimes you have to stand up for blood pressure. Sometimes you have to sit down, depending on what it is. Then the physician or the nurse practitioner has to see the patient and then actually do the physical exam and be able to capture all that information and then figure out, well, okay, so, what is the diagnosis? And then how am I going to treat that patient? So now I have to actually open up another application. What kind of medications am I going to give them? What kind of specialist do they have to see them? So really complicated workflows depending on really what's happening with the patient and also in the discussions between the provider and the patient. And then after the patient leaves, you have all kinds of follow-up activities. So what if a lab result comes back? What are the values of that lab result? So again, I think those are really important things. And if you're somebody that delivers babies versus, say, somebody who sees children, the types of things that you do are very different. So really, electronic health record systems are complex software systems that have to do a lot of different things. And I'm not even talking then about clinical decision support, about sophisticated rules about, well, you said you're taking this drug, but you have an allergy that may be a problem. So again, very complex system.
And so that's from
Then the problem is a lot of times we don't really know what to ask for. So I always give the analogy of the car. So I'm an engineer, okay, so I'm a little bit of a geek. And if you think about someone buying an EHR like someone buying for a car, you don't expect the person to say, yeah, I know the theory of a combustion engine, because they just want to drive the car. Well, right now you do kind of have to know about the theory of electronic health records in order to understand kind of what you need to buy. That's a really high bar. But then on top of that, can you imagine, not only do you need to know the theory, you got to pop up that hood and take a look and say, yep, that's a combustion engine. Well, that's hard to do, right? Not everyone can do it. And then not only that, was it put in the car in the right way? And when you start to turn the ignition, will it drive away?
Yeah, you have to configure the car as well.
Exactly. Well, and then you have to decide what kind of car, to your point, what kind of car do you want, right? Am I really into speed, so I might want to go in Porsche and know I have to pay a lot more? Or do I need a, kind of an SUV because I have a lot of kids, or in this case, patients that I might need to do certain things with? Or even do I need a pickup truck, right? Something that's sturdy, that can last a long time. Again, based on really what you need to know a lot more than others would. So you're absolutely right. How do you know? And then, as we all know too, it's about bigger than technology. So even with the car, sometimes it's not that just it works. Again, it's more like it's technology, yes, but it's about the people, right? Am I comfortable with using a computer or not? How is it going to change what I do? Am I comfortable with change? And then there's process, because how I do things in a paper world is very, very different than what I might do in an electronic way. So again, an example would be e-prescribing. So as a clinician, I used to have to write up a little piece of paper and give the prescription to the patient. Well, when I use e-prescribing, I add it into the computer and it automatically sends it to the pharmacist that the patient wants to pick up the medications with. So again, that changes the the processes. So again, really important. The other thing is the vendor market. Oh, sorry, I'm a little slow. Vendor market, the standards. Obviously, if we don't say, well, how big is a car, you can't ride on the roads. And then obviously it costs a lot of money. And for practices that are in small businesses, sometimes that cost can be really tough to actually negotiate, because you not only have the costs related to buying the software itself, but you have hardware. You have to look for fabulous consultants to help you maybe with setting up your wireless system. You have to think about what are the costs for maintaining it. You have to pay extra costs for hooking the systems together so you can get the lab results. So again, it's not such a simple thing of, oh, I'm just buying this and that's the end of it. It's actually integrating into your process. It's actually trying to figure out how you're going to be able to finance it and that you actually make the best decision. So it's really difficult. So you can go to the next slide.
Yeah, and to extend the car metaphor, it's almost as if cars were invented not all that long ago, and now everyone's having to learn how to use them and drive around.
Exactly.
So how can providers overcome some of these barriers?
Well, I think that the providers really have to rely on kind of their philosophy. As a physician, I know that, the standard practice is, do one, right, with a mentor, actually see one, then do one, and then teach one. So it's really, really important then for all of us to do the same as it relates to electronic health records in the clinical space. And why is it? Because it is complicated, because we don't understand all the nuances, and and we don't know kind of the inner workings of an electronic health record. We really need to work together to actually move us all along. And that way actually everyone benefits. So if someone implements, it's really important that they actually move forward together and actually share what they know. And I know that's a really hard thing to say, wow, I actually signed a contract and I didn't even think about asking about how much it's going to cost to build an interface. A lot of people don't want to brag about that, and again, it's important for other people to know, because if someone sees that that's an important thing to do, you'll have really been helpful to them. We actually have to be informed. We're talking all about being an informed consumer and knowing about the quality, but we also, as a clinician and people working in the ambulatory space, really need to educate each other on, how do we become educated consumers? how do we implement these things so we can mitigate our risk? Because again, it's expensive and we really can't afford not to do well.
So you're saying that sometimes people might be reluctant to share the challenges they face with EHR implementation, but that it's key if people are going to learn from each other's experiences.
Exactly, exactly. You know, and we face this in research where people don't publish their negative findings. In this case, we really do need to actually share our findings when they work or when they don't work, because that's the only way that we can be successful. And again, in this environment, we really need to make sure that we all are able to focus on taking care of patients and really accelerate our learning on how to be effective in using these tools. The other is, you know, from the vendor side, it's hard to respond to everybody's, you know, requests for details about their system, because everybody's asking for it in different ways because not everybody knows how to ask. And so it's hard on both ends. And if we all work together to say, here are the core things that you really need to know about a system so that you can pick one that best fits your needs, then everybody wins. And I think that's an important thing too. And then, you know, we can't address all the challenges with regards to standards, you know, in 7 days. You know, there is no God among us. And so then the challenge for us is, you know, what's really the critical piece that we would need in order for us to better be able to take care of our patients and actually help us with our workflow. So really coming together about prioritization. And then, you know, if there are critical issues like, hey, you know, we all have an EHR and it can't do Y, and we really need it to do Y, wouldn't it be great for everyone to say, this is really important, we need to do Y? Because then the vendors actually say, hey, there's a business opportunity, let's go build it. And then, you know, the question of how do we pick? As you know, in healthcare, we all get, you know, board certified, and we have medical licenses. The nurses, you know, continue to renew their licenses. The same is important for people who actually help us then implement these systems, and we have fabulous programs available around the country for accreditation. Actually, the medical board is going to actually now create the first board for physicians, specialty board on health IT. And then with regards to the products themselves, yes, we have, you know, the certification criteria for ONC, for meaningful use. But, you know, again, is that the low bar or is that the high bar? And what are some of the things that might be useful for all of us as consumers of these products to know and to feel comfortable about? So, again, really important pieces. So next.
So why isn't the information that people need readily available to them?
Well, you know, it's the too much and too little, right? And then all over the place if I can't find. Sometimes it's the notion of finding a needle in the haystack. You need a specific question answered, and, you know, there's too much. And it's scattered across a lot of organizations. Everybody's very interested in supporting their members, for example, on information relating to EHRs. So it's scattered all over the place with a nuanced focus depending on what it's for. Then there's things that are just not accessible at all. So for example, if you buy a certain product, a lot of times there'll be a private user community that actually is maintained by the vendor. So you can't see that if you haven't bought it. You don't know the challenges of the product, you know, as far as what works and what doesn't work. And so again, it's not accessible. And then if you even want to look, I mean, if you do a Google search and a Bing search on the web for EHRs, you get between 26 million to 18 million hits. Now, can you imagine? How do you find the information? It's overwhelming. And then it's really not organized to really meet the needs of someone that's really trying to step through kind of an implementation. And then, you know, obviously lots of things you have to pay for. And again, that puts yet another barrier because you don't even know if it's worth the money. So again, lots of challenges with regards to a lot of information distributed out, but not really when I need it and relevant to me. So a big challenge, actually.
So I think you've touched on it, at least incidentally, but what kind of environment is needed for optimal sharing about EHR implementation and use?
Well, that's a good question, and obviously, if we could wish for everything, it would be read my mind, right? Maybe it's the Google Glasses that's coming up right now, but that really isn't reality as we know it. And so I think the key thing, and again, I'm a little biased, but you need to be organized in such a way that people can find what they need, when they need it, and what's relevant to them. And I think that's really important. So if I'm an OBGYN or if I'm a pediatrician, that I don't have to go through documents that are really for some other specialty. It's a waste of my time. In addition, if I'm actually implementing a system and say let's make up eClinical work versus Epic, I really, frankly, don't care about how to use Epic if I'm using eClinical work. I'm really wanting to know about the system and kind of how to implement it in the way that makes sense to me. So again, the site really has to take that into account to really tailor information so that when I want to share my learnings with the broader community, that I can do it in such a way that it will actually help the person that needs it. And again, the clinicians are the ones that are really that are going to be making the decisions about buying or not. I would say the clinical practice, and even those that actually help the clinical practice, be it, the consultants and also the vendors that are providing the solutions, actually would be part of that environment. But really the focus is on the clinical perspective as far as how would you implement this in the clinical context. I'm biased. I think information should be free, and it should be easy to use because that's part of the culture of healthcare. You see one, do one, teach one, and that it's responsive to a community need. Because again, the environment and the technology is really only there to support, and everybody who is impassioned and believes how important this is really needs to let the people managing the infrastructure know what needs to be improved. The other thing is, because it has such a significant impact on people who are actually making a decision and trying to implement systems, it is really important that everyone is clear about any potential biases, again, why it needs to be transparent, how things are vetted. It should actually be peer-reviewed. And it needs to be independent. There really cannot be any sense of bias with regards to the information because it's just too important, and it will really intimately impact people's lives as they try to implement these systems. So it's really important for it to be as transparent and unbiased and independent as possible. And then the last point, obviously, is, if it's a nice, academic piece, well, you know what, love it. If I have time, maybe I'll go review it. But in the end, if I'm rolling up my sleeves and I'm really trying to figure out how to do something, I want it to be pragmatic. I mean, what works, what doesn't work, any nuance about why it might work, in your case, or why it didn't work is really important. And it should be timely and current. So again, these are the types of things that one really hopes for with regards to an environment that can actually move us forward.
So what type of information is useful then?
Well, again, I've talked to a lot of clinicians and have been around in many environments talking to people about, well, what is practical, what's not practical, right? And lessons learned are what I think the core of everything, because those are what we call in medicine those pearls. If a doctor, if your mentor tells you this is a pearl, you kind of all perk up and you write it, scribble it down curiously, because you know that this actually is information that can actually be very useful and important in what you do. So lessons learned are really critical because they are the reality of what somebody actually went through and actually can teach you. So I think of lessons learned to be kind of 4 different flavors. The first is, well, if I had it all to do again, this is how I would do it, because they may have not done it the right way the first time, right? So that's number 1. The second is, well, if you didn't do it the right way and you kind of get in a bind, this is how you get around it. So, how do you do the workaround, right? And then the third is, Well, say it was an issue that you really couldn't solve, you had a workaround, but then a vendor solved the problem. So there would be a solution. And then there's this last one that's informational. It's, well, you just need to know this. This is an important fact. And so that would be the fourth time. The resources also come kind of in a little different set of flavors. Resources could be something like a tool. So a checkbox or a readiness assessment sort of piece. Another could be that it's really just a document that provides some background that might be very helpful for people to use. And then another might be like I guess a mock contract or a document that you might be able to reuse. So those are things like resources. Gaps, there are different types of gaps in a community setting, right? The first gap would be, hey, help, there is no information about this, I need this, here's a gap. There might be another one that says, hey, there seems to be a policy issue here. We are required to do meaningful use and it needs to actually meet these requirements, but there appears to be a gap, so it's more policy directed. The other might be, hey, I need to do this so that I can do a better population approach to my practice, but the system won't let me do these kinds of things, and that would be really helpful to me. So that's more a technology, like, hey, there's a gap here, can you address it? And then there are things called discussion forums, which is sometimes you just want to float out some ideas and see if people have some other ideas that they would like to share with you. And again, that tends to be more less structured and kind of a different sort of a way to share information.
So what are some tips for people who want to share some of the lessons they've learned? How should they go about writing those?
Well, first, for people that are willing to step up and actually share what they know, really kudos, because it is so important, and I know how busy we really are. So when you really want to take that next step and be part of a real community, it's important to really make sure that you share it from your point of view. So for example, if you're saying lessons learned, you can make it personal. I did X, right? Or, I've involved nurses, for example, in system simulation prior to going live. It was a really great opportunity to adjust workflows. And if I wouldn't have done it, we would have run into some problems. So that could be one. It's personal. Again, you want to use neutral language and, not, like, oh, this is horrible and, expletives, because people tend to then get turned off and they are unable to really read what it was that you want to share, because usually when something upsets you, there was a real good reason why. And getting past the words sometimes is hard for people. So again, use neutral language and just lay it out. Always good if it's personal opinion, you don't really have to worry about it. If it's personal experience, you don't have to worry about it. But say you read something or you went to a meeting and it reinforced kind of your experiences, you can cite the other resources, because again, it enhances the credibility. And again, just like yourself, you don't have a lot of time to go read a few paragraphs of information. So really trying to strip everything out to what is it that they really need to know is really important. And obviously, since these are lessons learned, it's nice to say, well, this was horrible, but this is how you fix it. So making it actionable really helps people move forward to the next step.
So what are some additional tips then for people?
Okay, so in addition to all those wonderful little pieces to think about, discussion threads are actually kind of interesting because they're a little bit different. And many of you that are listening to this may have had the opportunity to join discussion threads. And I think, as you know, there is kind of a little bit of art to it. So whether or not it's a discussion thread to share your lessons learned and kind of your experiences, or if you're doing discussions elsewhere, there's some really important kind of how-tos to think about. Well, the first is, how are you going to get people to read what you wrote? Well, that means you want to have a good title. Make it clear what it is that you're trying to share and make it compelling. Again, clear focus. Don't want alphabet soups, because even though people that are very specialized understand all that stuff, you're narrowing your audience. So you really want to talk more in layman's terms. and actually define things and get people engaged. Again, key really is if you want someone to respond, you need to draw people in. Ask them something, as opposed to just stating a fact, which they may love, but don't expect people to then, join in on the discussion. Again, as I mentioned earlier, get to the point, cite and link. And again, post responsibly. Again, people are reading this and actually going to maybe make decisions based on it. And a lot of times discussion threads may be moderated to some degree, but again, people do read them. So again, lots of little tricks for you to think about as you share your experiences.
Yeah, regarding the acronyms, it's a problem in HIT if I can use an acronym. We sometimes have conversations here that we realize the entire thing was almost all acronyms.
Oh yeah, and HIT is not a nice one in healthcare, right? And then remember, ONC, it was on-shit. That was a very big kind of joke for many people for very long. And even the, K-HIT, again, think about acronyms and whether or not it invites people, but then also you don't want to be the butt of jokes either.
Right. Well, let's talk a little bit about Health IT Exchange and through the frame of why is this a good issue to be addressed through community interaction, and what are the stakes?
Yeah, no, thank you for bringing up that question. Well, bottom line, clinicians, and especially in small practices, are overwhelmed. They're overwhelmed not only because of their patients and kind of the core of their business. There's increasing regulations. There's changing, organizational structures for accountable care organizations. They're changing requirements, even with meaningful use and the clinical quality measures. And in addition to that, there's this kind of a push to rapidly implement complex systems like electronic health records. So here you are, there's a limited bandwidth for all of us, and these are people taking care of us. And we really need to work together to kind of mitigate kind of any waste of time on their part. Because if we can save, for example, a clinician 4 hours of time, let's say that they forgot to include some of the security requirements for the HIPAA and didn't really address it. They have to go back, redo the whole thing, and that's 4 hours of their time gone, okay? And where is it coming from? Now, if you think about 300,000 physicians, and these are just physicians, and you can think about the nurse practitioners and the nurses and the staff that works for them, and it's a ripple, the blowout, trickle down, but it's actually spreading. We can save about 1 million hours of clinician time. And then if you think about, well, clinician, and I'm being generous, sees 4 patients in an hour, because sometimes it's less than 15 million. Can you imagine if we focus that back to the community and actually allow clinicians to see 4 million patients? I mean, so even though we think of things in the term of, oh, what did I lose, what did I do, the implications of, how that can spread and how that savings can really impact our nation is pretty significant. Again, not only based on kind of, our philosophy as clinicians to really share and actually get people to use best practices, but even just in the human perspective of us as patients is pretty significant. So I'm very passionate and about it, as you can tell.
So let's talk a little bit more about Health IT Exchange, and I'm going to switch you over here in a minute to be the presenter so you can walk us through the website just a little bit. But as I'm doing that, maybe you can tell us a little bit about how Health IT Exchange fits into this approach that you've been discussing.
Right. Well, I think the important thing here is that, my bias again is that it's really important for us to have a way to share lessons learned, right? And I think that's a really important thing, and that it needs to be neutral. And so you have to understand from when I left from implementing electronic health records from a very big systems perspective, many hundreds of physician offices, I was really struck by the fact that we didn't really have a place where people could go to share lessons learned. And so this actually website was really created to provide an infrastructure that it was available to anybody in the United States and even abroad. Some people are using this internationally, where people could come and actually share what they know. It was really important for it to be unbiased, so we actually went to the Rockville Institute, which is associated with where I work, but it's a nonprofit, and basically, because they have no interest in health IT, okay? They don't have a policy position or members where there might be competition. And then I reached out to several organizations, and again, we allow others to join us, but AMIA, American Nursing Association, Health Level 7, and the HEMA Foundation are kind of the core partners who really provide oversight of and make policy decisions about what's acceptable and what's not acceptable. So again, really a agnostic, neutral site for people to share. And we also have peer reviewers that then actually are responsible for peer reviewing content also to make sure it's not biased and that it's correct. So kind of that's the backdrop. So should I give it a spin?
Yeah, show us how it works then.
Okay, so the first thing that you probably can see is that you got a bullseye in the middle, right? And basically what it really is the implementation cycle. And it goes from preparing, like saying, okay, I guess I'm going to do it, to then actually rolling up your sleeves from a business perspective to say, okay, I'm going to now, start doing the process and the money, and then the whole selection process. How do you select then, which way you're going to go? The most favorite for everybody, I am sure, which is the contract. And then even funner yet is implementation. And then after that, it's, okay, so how do we do? We implement it. Are we really where we want it to be? How can we think about what to do next? And thriving is really a really critical piece, which sometimes we forget about, which is now that we've implemented, how do we optimize it so our business is strong and improving quality of care measures for patients or optimizing it from a business perspective. So these are really core. And again, you can see the different colors. And again, they're actually a theme all the way through when you drill in deeper. The other thing you'll notice is that we have these things called views. And that basically really is that it's the type of information that's available. So we talked about lessons learned. We talked about resources. We talked about gaps. We didn't talk about links. These are external links that are actually going to be filtered based on where we are. And then the discussion. So again, we figured people didn't want to, waste time on a home page. We figured people wanted to jump right in so that they could share what they wanted to share. And if people do want to become a peer reviewer, you would apply here. So again, for any of you in the audience that might be interested, feel free. So let's go and give it a ride. So the first thing you see besides this popping up a little bit is that there's 4 different kind of major groupings here, which is people, process, technology, and other. And I don't know how many times you've been in a meeting and they say, oh, of course, it's technology, people, process, and other. Well, we took it to heart, right? And so that's really how any of these stages are really organized. Now, as you can see, this is a pop-up fly-out kind of menu. You can drill down for people into culture and stakeholders, processes, again, really important, technology, which gets pretty complex, as many of you know, and especially in preparing, other is kind of the grab bag of kind of like getting up to speed in the space, right? So if you have any information on that. So let me go then to people. And what you'll actually then see is what a more detailed page looks like with regards to the types of information available and how it looks. So people is a really broad category, right? And so I'm going to show you how to drill in a little deeper. But again, from just kind of an orientation perspective, what you'll see here is you can see that these are the high-level, cycles that you saw. So you can jump around, people, process, technology. Again, another way for you to navigate. And again, you can navigate with this little wheel here also. I can also drill down, because remember we have seen culture, stakeholder, decision makers, leadership, and things like that. And then what you see are all these little kind of things here, right? These are what we call the pearls. It's that 1 or 2 sentence kind of summary of something that's important to share, right? And you'll also see that there's some green check marks. That means it's been peer reviewed. And you can see that some are not. We have a philosophy of a share just in time. And people that go to the site understand if there's not a checkbox that it hasn't been peer reviewed. But it gives people an opportunity to quickly disseminate information that might be really important to share. Okay. Again, I can do the usual social media things. If I really like something, I can link it in or tweet it. I'm also able to, because I'm a member and I signed in already, save it to my library. So say I don't want to have to look for it again because I thought this was really important. I can now add it to my library, which is actually a nice little something to have. I can actually join a discussion about this Pearl, so you can see these are real users. I like talking too, as you can see on the post. And again, goes into a little bit of a dialogue. You can actually follow people and view things. You can actually create a feed too, which is actually kind of nice. So that's an important piece too. If you are interested in then resources, some people have posted things here. So again, here's one more from a tool readiness tool, which might be really nice to have available. Gaps, there's really no one's posted anything in gaps for preparing yet. And links I'll talk a little bit about later on. It's actually external links to a set number of health IT related websites and focused only on culture. But it's like a regular web search except more limited. And then the discussions that you've had the opportunity to see. And again, I can continue to drill down if I want to on lessons learned. So here I'm now looking only on vision and mission. And you can see as the narrower I get, the more specific the information would be. I can add things, and we'll go over that later on, so I can show you a little bit of what it's like to add your thoughts and expertise. So that's really kind of the core of the information and the type of information that you are able to share. If you go to the My Workspace, again, that's really something that you get when you are actually a member. And again, membership is free. And it basically provides an opportunity for you to do several things. First, if you are actually saving things, it's a way for you to get access to your library. In another way, if you are actually a peer reviewer, which is what I am, it actually lets you track kind of the progress of the submissions that you're responsible for sharing. And it also lets you do other things such as, what would I say, such as track your own submissions. So really important piece to think about. And let's see, I'm not quite sure why it's slow. But anyway, so those are really important pieces. I'll go into a discussion of what you're able to do with the links because I do think that that is actually a very, very powerful tool for anybody that is interested in health IT. Basically, the search links functionality allows you to drill in and actually search across very narrow sets of websites. Which I think is a pretty powerful thing because usually when you do searches, it really doesn't let you do that. So let's see. It's kind of flickering, which is interesting. Never done that. But of course, this is live. But yeah, so why don't we maybe open it up for answers while we see if we can get this to refresh.
Yeah, I'll switch back, and then we can switch back to you being the presenter.
Yeah. Sounds good.
All right, well, I'd like to open the floor up to questions from our attendees if anyone would like to ask a question. We have a couple of comments that we'll share with our presenter later, but we don't have questions at this point, so feel free to ask questions and I'll pass them on. And in the meantime, I'd just like to say to Dr. Rippen, the navigation tool I thought is very well done. It's easy to get around the site. Maybe you could tell us more about the links you were describing.
Oh, yeah. So the links actually, okay, so for the external links, what we've done is we've actually moved to identified what we thought were the core websites that were really important for people to track and to be able to monitor. So we actually are including CMS, always near and dear to all of us, I'm sure. ARC, because they are actually publishing some leading publications on the research relating to it. PubMed, because a lot of research is going on, and for those of you that want to actually see what's being published in the field, it allows you to do that. And the other is then some of the general publications like, AMI, American Nursing Association, HIMSS, some of the publications, Health IT News, and HRSA and things like that. So we really try to be thoughtful about what sites really are covering the field, especially as it relates to physician office EHRs. What it allows you then also to do is actually then filter it, but filter in a way that I don't think people are used to filtering it. And so actually I have it up now if you want to hand it to me.
Sure, let's take a look.
Okay, do you see it?
There it is.
Okay, so here I am in my workspace, and what you see here is always defaults to physician office, the ambulatory setting. Okay, so I'm going to actually open that up. And let's just say that I'm interested in what's happening in meaningful use. So I'm going to actually do meaningful use. I'm not going to restrict kind of how much. And, I see that there's a lot, but, let me say here, okay, I can actually restrict it. So PubMed has about 1,500 returns that are using meaningful use. PubMed Central is a broader piece. This is Health IT News. But let's go ahead and say, hey, I'm interested in the source because CMS is kind of the one that's moving it forward. So let's see what CMS has. So I get to actually now restrict and filter all of this only from those sources that come from CMS. And let's just say that I'm interested in tracking it because, I have to just make sure I'm not missing anything that's new. And so let's just say that I say, okay, in the last week, this last month, how many things have come from CMS with meaningful use. So here are all the things that actually have been identified as new on CMS's website that relate to meaningful use. So again, really an important and I think an interesting tool for people to look at. You can also, if there is any mention of specific specialties, you can narrow it. If you are interested in any specific practice size, in this case it wasn't really referred to. You can even do practice type if you're interested. And again, location, but remember location really is when anything is mentioned. So a lot of times it's, at the end, people's address and things like that. So again, a really fun tool for people to really think about. If you are interested, so again, I think this is a very powerful tool, and it'll help you kind of explore topics that you might be interested in addition to kind of, getting you excited about the community. If you are interested in submissions, this is really kind of your dashboard of keeping things up to date. As you can see, I haven't submitted 4 different things that are in the process, but this is one where I'm focusing on a resource. I came across something that was actually interesting from the American Medical Association, and so I actually added a resource. And you can see I summarized, not in this case, what did I do to make it so it would be helpful. I basically said what the resource covered, and this was a general overview of EHR, but then I also said who it was targeted for, because I personally hate it when I go to a link, and is totally irrelevant. So as much information that you can share about how to know, to let people know who it's for, is really appreciated. Again, this was from a website, and you can say, is there any place else on the implementation area that it could also be useful? In this case, it's really intro, and again, really reinforcing where we got it. So again, really important. The next thing to do is kind of, where did I get this? Since this wasn't a personal experience, it actually was a web resource, so I entered information about it. And this is a really important one to help people really target it well to people. So in this case, let's just say that I'm asking about practice type. If I say no, well, which type of practice is it best suited for? So I can actually pick whichever ones that I think, it's single practice only, right? So again, that's really important. But I know that it's general, so I'm going to keep it general. So I have kind of a theme, which is really, when you're thinking about it, some general kind of language, and some keywords, because it really is basic. And these are really core things here. You are allowed to actually post anonymously. And why is that important? Well, again, like we said before, if it didn't work, you don't want to be bragging. Not everybody wants to be bragging about, oh, I did this mistake. So you're allowed to post anonymously. It's still associated with you, but you can post anonymously because we feel like that could be a barrier. And since I don't care, I'm going to do that. The other thing that's really important is that you follow the code of conduct. Again, that's a really important thing. It's basically that, you're going to respect people, that you're not going to actually do things that, wouldn't be really the right thing to do. Again, really important thing for people to do. And then you would actually then just say, okay, I agree, and you would move on. So again, these are some important things for you to think about and also, actually do. One of the things that would happen upon you submitting is it actually gets routed then in a queue to get peer reviewed, and you would then get notification on when you go to your workspace that it's ready for you to sign off on, and I think that's an important process. So I'll hand it back to you.
There's a lot of great tools here. I personally believe that any community discussion like this, to be useful, really needs to have a code of conduct and does need to be moderated to an extent to make sure that it remains focused and that it's useful to people. So I'm glad to see that. Another thing I thought, when you were going over the links, that really speaks to what you were saying about how there's too much information and it's spread across too many different places. That lets you take a very targeted, focused approach to the information that's out there. So I can see how these tools would be very useful for people. We do have some questions.
Well, we hope so, and again, we really hope that, I know we're really busy, but the only way that we can move the market and actually reduce all of our risks as a collective group of clinicians trying to implement this, this is really the way to do it. And that includes also all the fabulous consultants that actually help clinicians, because a lot of times it's not that they're going to be implementing it, but they also want to know what they need to know, because again, it's going to impact their life. So again, I think that if we can work as a community, I think we all could be pleasantly surprised about what we can accomplish as a community.
Well, let's get to some of our questions while we still have a little bit of time. Here's a question from someone who's, it sounds like they're transitioning. The question is, having not used the site, is there a discussion about EHR users transitioning to a different EHR when their current product is being sunsetted?
Oh, not yet, but that would be a fabulous one. As many of you know, and the person submitting the question already knows, that actually is a growing issue. That not only are they having to change because products are sunsetted and are unable to support them for attestation for meaningful use, that some are actually realizing that the product that they got really doesn't meet what their needs. So there might be some information relating it to on the site. I would believe that at least on the search links, you would be able to find resources. But I do hope that you would actually become a part of the community to actually share your your experiences as you go through the process, and you would become a community leader just by doing that.
Here's another question for you, and I'm not completely sure what the questioner is trying to get at, but the question is, are you in communication with any individual states that are setting up their exchanges?
For the HIEs, actually,
Yes.
we have we've talked to 1 or 2 health information exchanges about them potentially contributing insights as it relates to the core piece, which is, you know, having ambulatory EHRs actually work together with their HIE infrastructure. Because again, remember that not only is it important from the physician office perspective or the ambulatory perspective, it's also important for the HIEs, it's also important for the hospitals that they actually come together with regards to interfaces. So we understand that that's important, and perhaps if they're interested in joining the community and championing that, that would be great.
Well, we're starting to run out of time. Are there any final comments you'd like to make, Dr. Rippen, before I wrap it up for us?
Yeah, thank you. For all of you that are involved in helping move physician offices and ambulatory healthcare settings forward in electronic health records, be it if you're the provider, the staff, the vendor, or the consultant, it really is important for us all to work together to actually come up with solutions to be successful. I do know that it takes people time and commitment, but without that initial investment, we won't be able to reap the rewards of that investment. So again, spending, you know, half an hour, an hour, you know, maybe a week or a month actually can save you hours and hours of time in the future just by learning from others what they shared too.
Well, thank you, Dr. Rippen. I want to
Well, thank you, and again, I appreciate that everyone took their lunch time to come up and call in. And again, if anyone has any questions or would like to chat, I'm sure that you know, everybody would support that.
Yes, I'd like to thank you again, and I'd also like to thank our attendees today. I'd like to remind them that we're going to assemble all of the audience questions and post the answers on our site with links delivered by email later in the week. All registered attendees will also receive an email with links to both recorded and PDF versions of this event. You can learn more about Health IT Exchange by visiting healthitexchange.org. To help support the mission of Health IT Exchange, vendors and organizations can sponsor the ForMed Marketplace by visiting formedmarketplace.com. Be sure to join us at ForMed Approved for our next Learning Lunch, which will air tomorrow, April 24th. We will have a panel discussion with experts from Isabel and Body Media on what's new in mobile technology for healthcare providers. Keep an eye on your email box and our homepage for our other upcoming topics. And thank you again for joining us today.
Thank you.